Hello and welcome to Pavitra Connect. Today, on World No Tobacco Day, we have with us two very eminent doctors in their field. I'd like to introduce first Dr. Yuvraj Bhosle. He's done his MBBS from Grant Medical College, MS and DNB, Diplomate of National Board in Anatomy from Grant Medical College and JJ Hospital. Also a diploma in Human Resource Management from Wellingkers Institute, has postgraduate diploma in hospital and healthcare management from Mumbai University, has also done a postgraduate diploma in higher education from IGNOU in Indira Gandhi National Open University, New Delhi. He's also received a fellowship in medical education from GS Medical College and FEMA, Philadelphia. And along with him, we have Dr. Vishnu Agarwal, consultant oncosurgeon, laparoscopic and robotic surgeon, head of Department of Oncology at Bhaktivedanta Hospital and Research Center, honorary consultant oncosurgeon at Jaslok Hospital, Sefi Hospital, ACI Kambala Hill Hospital. Has tremendous experience and training in surgical oncology, a fellowship from Tata Memorial Hospital, Mumbai, has done extensive training in laparoscopic and robotic surgery from South Korea and France, specializes in treating breast cancer, uterus cancer, ovarian cancer, colorectal cancer, head and neck cancer. Has operated over 3,500 Indian and international patients, and his main expertise is in doing breast conservative surgery and oncoplastic surgery for breast cancer. Also has a team of plastic surgeons for breast reconstruction, robotic surgery for head and neck cancers. Dr. Vishnu Agarwal has done maximum robotic neck dissection for oral cancers in South Mumbai. This leaves no scar in the front of the face and neck. Laparoscopic and robotic surgery for gynecological cancers and colorectal cancers. Cytoreductive surgeries for ovarian cancers as well. Our two eminent personalities will today take us through causes of cancer, especially related with smoking, and how the body gets affected by nicotine, tobacco. And I leave it now to the experts to take it forward. Dr. Yuvraj Bhosle, over to you, and thank you so much for being with us this evening.
Thank you so much, Pushkar, for your kind introduction. Um, Whenever we have these different days like Women's Day celebration and we have Mother's Day celebration, but when it comes to World No Tobacco Day, it's not a celebration. It's more of a commitment that we don't get addicted and we help others who are somehow got into this addiction of tobacco. Before even I ask the first question to Dr. Vishnu, I just want to tell you some alarming figures and the association of tobacco with cancer. Of the different cancers that we find all over the world, 35% of the cases in males and 18% of cases in females are attributed to tobacco consumption all over the world. In India, the proportion is more. It is 50%. 50% of the males, the cancers which are seen in the males are due to tobacco, and 15% of the cancer seen in the females are due to tobacco. And if we see the various cancers, like 30% of the cancers of the head, face, and the neck are due to tobacco. And of these are the 40% ones which are seen in the oral cavity. And the amount of tobacco addiction, especially smoking in India, it is 19% in males. Now, thinking about a 1 billion population which is there, 19% is a huge number. 16% in teens, okay, and 9% in females. And 40% of our population, 40% of our population is exposed to passive smoking. With all those figures, I would like to welcome Dr. Vishnu Agarwal, and I would like to ask him the first question that, all this evidences are there about tobacco and cancer, but do you, the cancer surgeons of today, have a direct evidence with you about connecting tobacco with cancer?
Good evening, sir, and good evening all the members of this group for inviting me for this very good session on this very important day, World No Tobacco Day. The theme of this time's World No Tobacco Day is commit to quit. So that is very important. And sir, as you already actually explained in your statistics that how much cancer in India as well as all over the world is attributed to smoking or tobacco chewing. So it itself proves that there is a direct connection between tobacco and cancer. If you see, 90% of lung cancers and even 90 to 95% of oral cancers are in those patients who have either chewed tobacco or have done smoking in one way or the other. It's a 90%. So if you see, if these tobacco and the smoking is prohibited or it is totally abolished, then only 10% of the population who is getting cancer will get cancer actually. So 90% will be avoided. So it's a direct connection between the smoking or tobacco chewing and the cancer. Now coming to what type of tobacco and what type of smoking can cause cancer and which part of the organ is affected, that is also very important, because if you see in the world, in the Western world especially, there is hardly any tobacco which is chewed. Actually, most of the tobacco is consumed in the form of smoking. So India is suffering for the maximum number of the cases of oral cancer, and that is because India is the hub for tobacco chewing. If you see the statistics, more than 40% of males chew tobacco or take for smoking, and 15% of the females also do either tobacco chewing or smoking. So this is the statistics of India. Whereas in the Western world, it is mostly smoking which is causing. So smoking does not cause so much of oral cancer. Also, although it can cause oral cancer, but not that much. Which are chewing tobacco, which is prevalent in India, causes oral cancer. Not only these oral cancers or the upper respiratory tract cancers or the lung cancers, smoking or tobacco chewing is also associated with other forms of cancers in the body. Like when person smokes, he inhales all those chemicals. There are around 70 harmful chemicals which are carcinogenic in any form of tobacco. Any form of tobacco it may be. We may say that we use this tobacco or this, it doesn't matter. Any form of tobacco has almost 70 chemicals, and out of these some are more dangerous, and these chemicals which are inhaled in the lungs, it goes to the blood vessels, and from blood vessels it goes to the kidney, it goes to the urinary bladder, ultimately it goes to other organs like pancreas and all those. So smoking doesn't only cause lung cancer, it can also cause pancreatic cancer, it can cause urinary bladder cancer, it can cause female cervical cancer and ovarian cancers. So these are the like direct causes of the cancer actually.
Thank you so much. And I think 90% is really a big figure, if the tobacco is contributing to these cancers. I just want to know the exact mechanism or some chemicals, the important, you said there are 70 harmful substances. Can you just elaborate on one or two by which we can, which are the killers and which are the cancer causing agents?
Yeah, so I'll just explain one chemical and the mechanism by which it can cause cancer. Like there is a chemical called benzopyrene, which when it is inhaled in the form of smoking, it gets converted to epoxide. And epoxide is a very small molecule. It can easily enter the cell and it can easily enter the nucleus of the cell. And our DNA, our genetic, all this infrastructure is present in the nucleus. So when this chemical enters into this DNA, it damages the DNA or it alters the DNA, which is called mutation of the DNA. And once the DNA is mutated, normally what happens when the cell gets aged, it gets destroyed by the mechanism of the body. It is called apoptosis. But when the DNA is altered, then these abnormal cells or the deads or the cells which are already old, which are of no use to the body, they get altered and they do not die. Rather, they grow very rapidly and they outgrow the speed of the growth of normal cells. And these cells are non-functional cells. These cells are like parasite on the body. They take nutrition from the body, but they don't perform any function. And these grow at a very speed, it's a very high speed, and they form which is normally in a layman's language, it is called tumor or a lump. So this tumor or this lump grows, and it becomes like the thing which invade all the structures. First, it invades the surrounding structures. So if it is in the lung, it will invade the alveoli and then it bronchus. And then once it invades the structures, then it goes into the blood vessels. And once it goes to the blood vessels, and as we know that the blood goes to the heart, and heart distributes this blood to all the organs like brain and kidney and liver. So we see when we say then this patient is in stage 4 cancer. So what is that stage 4 cancer? Stage 4 cancer is that in which the cancer has gone from a localized area, that if it was the lung, then it has gone from the lung and it has gone to other organs like the brain and the liver and all other organs. So this is called stage 4. So this is the mechanism by which a chemical causes cancer. And more the number of exposure and the more the years of exposure, it is not a one-day disease. We cannot say that I have been smoking since 1 year, I didn't get any cancer. We cannot say like that. It may take 10 years also, it may take 20 years also, it may take 30 years also. This is a slow process, but definitely say 50% of the smokers, 50% of the smokers are going to get cancer. That is the
Thank you so much, Dr. Vishnu. And you are talking about that smoking causes lung cancer. And yesterday in the Indian Medical Association, we were discussing that India and all over the world, people have a habit of smoking and having alcohol together. So that time, that tobacco mixes with the alcohol and affects the, the floor of the mouth. And that's how smoking can, when taken along with alcohol, a cigarette, it can also cause a oral cancer. And now I would like to take the discussion away from cancer a little bit, because I think it's already now a proven fact, and you have the kind of statistics which you have provided to us, they are very alarming. But I also want to know that are there any other diseases and any other harmful chemicals in tobacco which can cause any other diseases apart from cancer?
According to the statistics, worldwide 8 million deaths are caused due to smoking. Out of those, only 3 million deaths are due to cancer. 5 million deaths are not due to cancer, are due to other diseases. So smoking has a harmful effect on all the organs, and it's not only the cancer. So when these chemicals are inhaled, they are, as I told, sir, that they are distributed in other organs. So it goes to the heart, it goes into the coronary vessels, which supplies the blood to the heart, and they cause blockage of these coronary vessels. They cause constriction of these coronary vessels, and from the heart, when the blood goes into the brain, so these cause damage to the vessels supplying the blood supply to the brain, and that is the cause of stroke. So if you see that the risk of a person getting stroke or a heart attack is 10 years earlier than the normal person when he is not smoking. So it is a very important factor that these diseases are very common in those who are smokers, and that is why 5 million deaths are attributed to these kind of disease. Other diseases which are caused by this is infertility is very common in these patients who are smoking, both male and female infertility. Then there is called Burgess disease or peripheral vascular disease. So it causes the constriction and the thrombosis of the peripheral vessels of the body. So it may cause gangrene of the foot, necrosis, and all those things. So these are the various other
Yeah, so
things.
Vishnu, Dr. Vishnu, you're talking about the various diseases, and thank you for bringing it up. I think nicotine is the chemical which is also equally harmful. Now, you talked about infertility, so I just wanted to ask that smoking during pregnancy, how bad it is for the fetus?
So it is quite bad. It causes premature birth. It can cause ectopic pregnancies. So these are the facts, and also it can cause damage to the organs of the baby right from the developing stage, like to the heart and to the brain. So these are it's very harmful in pregnancy. So one should strictly avoid smoking in pregnancy.
Thank you so much, Dr. Vishnu. And we have some questions coming up from the audience, I can see here.
Yes, sir.
And one of the questions, which is about vaping, which is nowadays, kind of trending, and people have a feeling that it doesn't cause so much damage like what a direct tobacco consumption can cause, or maybe hookah. And people have kind of a feeling that this whole poisons of the tobacco get filtered as they pass through the water. And can you just throw some light on this, that this vaping and hookah, is this equally dangerous as a regular tobacco consumption?
Yes, sir. So it's very common now, vaping, especially in the teenagers, in the school-going children, because people think that vaping has different names also. Like you must have heard of electronic cigarettes, or hookah is same as vaping. Uh, so now there are many names, alternative form of nicotine, that is another name, A&D, like this. So there are various names of this vaping. So it is nothing. If I just explain you what it is actually. It is like there is a liquid, and there is a battery in that device. So once you on the battery, then liquid turns into the vapors. Actually, they call it vapors, but it is not vapor. It is the aerosol which is generated, and that aerosol contains nicotine, and which causes a flake. So many people think that they doesn't, but it is having the same amount of chemicals, so same chemicals which a normal tobacco or normal smoking has actually, but maybe in a little lesser quantity. So it will definitely cause harm. It will definitely cause all these diseases which normal tobacco is doing. It may take more time, and it sometimes it may not cause, but in very few people will be like benefited. In most of the cases, it is going to cause the same harm. So we should not fool ourselves by saying that vaping will prevent us from the cancer like that or from other
Thank you.
diseases.
Thank you so much. There is one more question coming up from the audience, and this is a doubt which is in the mind of every person who is there on the show today. And that is that there are some people who keep on smoking and they live for 100 years and they don't die of cancer. And there are some people who never smoked and they got lung cancer. So that's the question, when it comes to tobacco and smoking, and which I think an expert like you can give a very good answer to us.
Sir, actually, this is very ironical to think like that. So I'll just give you an example. Suppose nowadays the COVID is going on. So the statistics of COVID is that there's a 1% mortality out of those patients affected by the COVID, and like 10 to 15% will go to hospital, and only 3 to 4% or 5% will go to the ICU. But does that mean that we don't take precautions for COVID, because we don't know which 1% is going into die? So similarly, this case it's only 1%, but in case of tobacco, it is 50% patients are going to suffer because of cancer, because of tobacco chewing, or because of smoking. So how do we know that whether we are going to come in those 50% or we are going to come in those 50% who are not going to? That is one thing to logically to think. Another scientific thing in this is everybody's genetic structure is different actually. So some people may have some genes which are resistant to these tobacco chemicals, and that may lead to not getting cancer. And there is a study in London which has been published, which is saying that there is vitamin B6 and methionine. These are the vitamins which a person who has more of amount of these vitamins in the body, that is protective against the damage caused by these chemicals. So people having these vitamins have lesser chances of getting cancers because of the tobacco or smoking. So that is a study which is published, but still we don't know actually exactly. We don't know why this happens, but we cannot bargain this that okay, this is happening, and so will, because 50% you can come in those 50% which are like getting affected by cancer. So it's a huge amount actually.
Dr. Vishnu, this is the almost kind of a last question I'm taking from the audience, and this is regarding passive smoking. And how does passive smoking of tobacco, which the statistic shows that 40% of the population is exposed to passive smoking in India. So how
Yes,
passive smoking is dangerous, and if you can let us know, and those who are listening or whole audience, that this will be very beneficial, so that if I may not be smoking but somebody in my home is smoking, how does that damage me?
Sir, very right. You are saying this passive smoking is very dangerous. If you see, when a person inhales the smoke, inhales the cigarette, only 1/3 of the smoke goes into his lungs, and 2/3 is goes outside actually. So children at home are the worst affected with this passive smoking. If you see, the 8 out of 8 million deaths, 1.2 million deaths worldwide are due to passive smoking. So that is the statistics. So it is very important actually to understand for the people in general that we are not only damaging our body, but we are damaging the body of others who are maybe dependent on us, who may be our kids also, and who are our very close relatives. So it's very important, very dangerous thing. And passive smoking can cause the same amount of danger, the harmful effects to the body as the active smoking. As the time passes, it may take more time, but it may cause the same amount of damage.
Thank you, Dr. Vishnu. And here comes the last question, that yes, I understood that tobacco is bad, but what if I am addicted to tobacco? So what does the field of medicine offer to addict who wants to get de-addicted from tobacco?
So there are many things which we can do. If you ask me, you can send those people who are addicted to my OPD. I can I can show the patients who are going to get operated and who are already operated. If a person sees their faces, and I don't think only the very bad means mentality person will continue tobacco chewing. Because when a patient chews tobacco, the whole, sometimes we have to remove half of the face and we have to reconstruct with some flap. He can, and after the surgery he has to go undergo radiation and chemotherapy, so he cannot eat also for lifelong. Actually, their life is worse than a hell, actually, if you see. So if we can just, as a doctors, if the patient is coming for, so we can show some of the photographs of those patients actually and tell them that this is the result which is going to happen after 10 years of your smoking or after 5 years of your smoking. That is one thing. Counseling is very important. We should show the examples. We should tell them that how people have suffered from those. Secondly, the motivation should come from the family as well as the person who is affected. So he should be determined that I have to quit smoke somehow. So that determination, and there is a psychiatric counseling also which psychiatrist gives. They're like we should choose a date, some special date a person can choose. Okay, and it should not be immediate. It may be 1 month afterwards, that okay, this is the day, this may be my birthday or some relative's birthday or some special day, that this is the day which I am going to quit smoke and nothing to be done later. And should avoid the association of people who is smoking. Actually, if we associate with such people, even thinking okay, no problem, they may be smoking, I'll never start smoking again, but that doesn't happen. You may resist for 1 time, 2 times, but again it will happen. So this is one thing, association is important. And then there are various medications also, like you may have heard of nicotine chewing gums. So that also, it's like parallelly, in the sense to just de-addict the person. It is not that we can take it for a lifelong, because they are also harmful. So for some time, till the time we are de-addicted from the original tobacco, we can take this nicotine chewing gums. And there are various medicines also which the psychiatrist will prescribe, which can help us in de-addiction. These are the things. And on the other hand, since this tobacco chewing actually starts, why it starts? Sometimes it starts with peer pressure or social pressure or some feeling cool and all those things. But most of the times, the smoking or tobacco chewing, it starts because of some emotional pressure or some stress in the life, which a person is not able to cope up. And even in the children, so much pressure is there from the parents, from the society to get to perform and all those things. So there's a lot of pressure which leads to the smoking. So we should not give so much pressure to our children. And secondly, we should try to control our mind. So there are many ways, like yoga, like meditation, like some form of spirituality, which can be taken up in the life to control our mind, so we do not deviate to these things. So these are the factors which I can
Thank you
suggest.
so much. And I really liked your last point, what you spoke about yoga and spirituality. And that's what we are going to discuss. And we have our next speaker for that. And I'll request Pushkar to introduce our next speaker. And thank you so much, Vishnu, for being on the show and, giving us so much knowledge and to us and to the audience. And on
Thank
behalf
you so
of the
much, sir.
audience, I really thank you. Over
Thank
to
you so much,
Pushkar.
sir, for this opportunity. Thank you, sir.
Thank you, Dr. Bhosle, and thank you very much, Dr. Agarwal, too. Uh, Fascinating facts, very scary, in fact. I'm sure anyone who's watching this program and is a smoker would decide to quit as of right now. But definitely prevention better than cure. Our next speaker, Vivek Bansal, mindfulness coach, educator of meditation and yoga philosophy. His experiences as a successful software engineer, as a monk for 20 years, and as an integral part of many yoga TTC programs in India and abroad, contributes to his rooted wisdom and creative approach in teaching. He believes in transforming all the layers of one's personality: physical, emotional, intellectual, and spiritual. He has created noteworthy programs merging Vedic knowledge, especially the Bhagavad Gita, with modern psychology to help people in their journey of awareness of the self. He also offers personalized coaching sessions and courses for holistic growth, intra and interpersonal, applying meditation, mindfulness, and other essential life skills. Over to Vivek Bansal, somebody who I follow and I have great regard for as well. Uh, Dr. Vivek Bansal.
Hello, friends. So I would like to share some of the de-addiction programs for tobacco and nicotine, especially with all of you today. First of all, the person who is addicted to tobacco or say nicotine in general has to realize the ill effects of nicotine does to our body, which doctors have described very nicely. But besides the diseases and the physical harm, there is a lot of things happens at the emotional level also. Mm. Person start having mood swings. Person may start becoming irritable easily, or even it harms at the skin level. It even harms the eyes. So many things are there actually, and they feel the smell. It's so expensive, and it's like a waste a lot of time every day. Mhm. And the people who are dependent on us, they start following us. So there are many things which happens at the emotional level and at overall personality level. So we need to consider that also. The ill effects, and that will be a motivation for us to come out of it. So what happens basically when person start smoking? It's actually it begins with just one cigarette. But then the neural networks in our brain, they start forming a pattern, the belief system, that if I take a cigarette, if I take nicotine, then I will feel relaxed. I'll feel good feel factor. So when person take nicotine, there is a dopamine rush happens, and which makes person feel good about himself or herself. So the point is that we need to first go to the root of the problem actually. The root of the problem is that the desire to feel good about oneself, desire to feel relaxed. Because many times people start smoking when they feel too stressed out, when they feel too much of fear in their life, a lot of other negative emotions. So basically in yoga and meditation, we focus mainly at this root cause of the problem. And the problem is not having enough relaxation in life. People are so stressed out, people are so much burdened in so many kind of issues and negativity around them. So that's why in yoga and meditation, and especially the pranayam work, the breath work, we actually learn some breathing patterns which can makes us calm and composed very easily. And some of those things I would like to share with you. Very simple breathing exercise which person can do anywhere, anytime. Because I'm not talking about just pranayama doing in the morning or yoga doing in the morning or evening. Because the urge to smoke can come at any time. Why it can come anytime? Because the patterns have been formed in our subconscious mind. So what happens is we have a conscious mind and we have subconscious mind. Let me speak a little bit about it. Conscious mind is just 10%, and subconscious mind is like 10 times more powerful. So when somebody start taking nicotine, the all neural networks, they start forming in the subconscious mind. And even if person decide that I will quit, or he or she hears some lectures about it, or some kind of resolve he or she makes at the intellectual level, at the logical level, there is constant fight goes on inside us. Should I quit or should not quit? And again want to have run back towards that direction, because the neural network, the patterns in the subconscious mind is pushing him or her to again go and smoke. So that's why we need to actually release all kind of toxins, basically you can say, even from the subconscious mind. And also we need to work on feeling relaxed whenever we feel like having urge to smoke, because person feel panic or fearful or stressed, and that person runs for smoking. So some very simple breathing exercise I want to start with. Like you can be anywhere. This is called yogic breathing. This is one of the most important and very easy step in yoga, which can release us from any kind of anxiety, any point of time, and calms down. So generally what happens is when we are born as a baby, our breathing pattern is very natural. And that breathing pattern is not the shallow breathing, it is actually very deep breathing. And the deep breathing means that when we are inhaling, our diaphragm is pushing down because lungs are becoming more and more filled with the air, and it pushes the belly out. So if you have observed these babies when they breathe, very natural yogic breath. They inhale very deeply, and when they inhale very deeply, diaphragm pushes down and the belly comes out. And when they exhale, first belly goes down, and then gradually all the air from the lungs comes out. So this actually causes a lot of relief, a lot of relaxation. Because now what has happened over the years, because of some emotional trauma, some kind of stress, we have forgotten how to breathe, most of us. Why we have forgotten? Because you can remember, you can just imagine, you can just think about it. Like when we are angry or frustrated or too much anxious, our breath become very shallow. We start breathing from here. And when we start breathing from here, again it becomes a pattern. And when we breathe from here, it's actually what happens is heart rate is not so slow. And the lungs have to do much more hard work actually because the full lungs are not getting filled with the air and oxygen. So the whole idea of yogic breathing is and becoming calm and peaceful to begin with, just to learn first yogic breathing. Let's try now. If you're just in a situation right now, just sit with your back straight in any kind of yoga pose. What is very important, especially in meditation, pranayama, that we keep our back straight. Even if you're not able to sit with your crossed legs, even if you're sitting on a chair in the office or anywhere, just keep your back straight. And after keeping your back straight, close your eyes just for a moment, just for a few minutes, or maybe like 30 seconds or 1 minute, just 2, 3 yogic breaths, and it will really, really help you. So close your eyes. Let's take this time to practice yogic breathing. Connect with your breath. Connecting with your breath means start observing your breath. Your breath is going in and coming out, but it is not so deep. Now inhale deeply so that your diaphragm pushes your belly out and your lungs are filled with airs. And then exhale very slowly and completely. As you inhale, imagine you're taking the prana vayu, the living force, and energizing every cell of your body. And as you're exhaling all the toxins you have accumulated in every cell of your body, just throwing it out. Now inhale at the count of 4. Inhale, 1, 2, 3, 4. And exhale at the count of 6. Exhale, 2, 3, 4, 5, 6. Continue with the same practice. Inhale at the count of 4 and exhale at the count of 6. Now, as you're inhaling, remember your diaphragm is pushing down the belly and you're having complete yogic breathing. Your lungs are filled completely with the air And you're exhaling very slowly and completely. Now take your awareness to the inner walls of your nostrils and make your breath more deeper and subtler. And while you're exhaling all the toxins and desire to be addicted to nicotine. Now bring your awareness to your forehead, eyes, cheeks, lips, jaw, and tongue. Now gradually make your breath natural. Just natural breath going in and coming out. And open your eyes. So this is a very simple exercise, very simple breath work exercise which you can do in your office, in your home, even in the car, even in the train, wherever you are. Just sit for like 2 minutes and immediately you will feel so relaxed and calm and peaceful, because the whole cardiovascular system become relaxed by this. And what happens is the whole nervous system become relaxed by this. That is the main thing. Because when we talk about de-addiction, it's all about calming down your nervous system, because the nervous system plays the most important role in our stress, anxiety, fear, all these negative emotions. And the moment we calm down with nervous system, we become very peaceful. So the whole idea of pranayama and meditation is to calm down your nervous system. There are some asanas also to calm down your nervous system. One of the most important and very famous asana is Shishu pose, child pose. Now, child pose is very simple. You have to just sit on your ankles and your both the knees are spread apart. And then gradually you come down to the surface on the floor and touch your forehead on the floor. And take both of your hands ahead further and stretch your hands in a very relaxing pose. So what happens in this pose also, nervous system calms down. This is a very famous pose. You can check on the net, child pose or Shishu pose. And another very famous pose is Shavasana, corpse pose. That we lie down on the floor with the back on the floor and both the hands beside our body, our palms are facing upwards. And then gradually you begin with the same kind of yogic breathing which I just taught you. Same kind of yogic breathing. Do for like 5 to 10 yogic breathing, and then take your awareness to your toes and to the feet and to the ankles, and gradually bring the awareness up and up and up to the knees and to the thighs and lower back and upper back and belly and chest and hands and face and brain. Just say yourself while breathing, I relax my ankles, I relax my knees, I relax my thighs. Mentally just talk like this, and again your nervous system will become very peaceful and calm. And that's what is very much needed when we're talking about the addiction, because we need to find some things for the subconscious brain or subconscious mind, that the same effect which we are getting from nicotine, we start getting from something else. Because just by saying to the conscious mind that it is not good and it is going to cause some disease, it is going to cause some cancer, then it doesn't work actually, because many people keep hearing about it, but they are unable to give up the habit, the addiction, because the subconscious mind is used to get some kind of effect which is looking for, which is, I just told you, as soon as the person starts smoking, there is a dopamine rush. Dopamine is a hormone which actually give you good feel factor. And when there is a good feel factor, person feel like if I smoke, then I'll feel happy, I'll become better in my life. But the problem is that the nicotine is a poison because it has so many chemicals as doctors have described about it. And whenever there is a poison goes inside the body start fighting back with it. So the person who is smoking doesn't even observe that he or she is having the heart rate increase and body is fighting for it, and so many other things are happening which are not very positive. So person may feel that he is getting relaxed or calm and peaceful. Instead of that, he's actually harming his body and mind and the whole nervous system. So if we can train the subconscious mind in a different way, if we can reprogram the subconscious mind, which is called neuroplasticity. Now, this is something very interesting. Neuroplasticity is something like you just train the neural networks and the neurons in a different way, because we have billions of neurons in our brain, and the way we think, the way we read, we observe, we experience, based on that our neurons start making networks in our brain. So if we can program our subconscious mind, which is like 10 times more powerful, uh, then actually detection can take place along with the breath work we are doing, because breath work immediately gives us relief, the same kind of relaxation which a person get for some time from this kind of addictions. So how to do reprogramming? This is also just for a few minutes to share with you. That first person has to start reading some blogs and articles and understand the ill effect of smoking or nicotine or tobacco or whatever overall personality at physical level, emotional level, intellectual level, and everywhere in the relationships. And once person is convinced that then person has to make her own decision to quit it. Person has to contemplate on various things. This is where meditation comes into picture. Person has to start meditating and start imagining the life he or she had before he started intoxication, and now what kind of life he or she has. Because sometimes person has the feeling that if I give up the smoking, that I will not be able to enjoy my life, I may not have the social life. These are all myths actually. It doesn't work. The person has to contemplate about it. The contemplation is very important uh, to get into this mood of relating with the emotions and feelings. And another thing which is very interesting, which I recently came to know, which is something called mindful smoking. Instead of giving up like one day, for few days, person has to do mindful smoking. Mindful smoking or mindful chewing of the tobacco, that when that person is smoking or eating some tobacco, the person has to remember or imagine or think that what benefit this cigarette or this tobacco is doing to me, how I'm benefiting from it. So that kind of contemplation, what kind of harm it is doing, this mindful smoking will convince reprogram the subconscious mind. Again, the rewiring. The subconscious mind has been programmed that it is going to be very helpful and it is very nice, but this kind of thing is very, very helpful. And then person has to start making the affirmations that I am good, I'm enough, without cigarette also I'm enough. And I'm out of delusion. I love myself. I'm now a known smoker and I'm complete. So this kind of positive affirmations again will create a kind of what you say, reprogramming of the subconscious mind. And another one more relaxing technique what I would like to share with you, which is very simple again, very famous among yoga and meditation groups. It's called Brahmari Pranayam. Brahmari Pranayam is a pranayam which again can be done any time of the day, like yogic breathing, any place. You will not feel like very awkward about it because you have to just sit straight. It's also called humming bee pranayam or humming bee breathing exercise. And it completely calms down your nervous system in 2 minutes. This is so powerful. So you have to just sit with your back straight again, like you said in the yogic breathing posture. Your back has to be straight, your back of the head in the line of your back, in the line of your spinal cord if possible. Your neck is not hanging here and there. Let's try now. And then just sit with your back straight. Close your eyes. Relax your facial muscles, your forehead, your cheeks, eyes, lips, jaw, and tongue. Observe your breath. Inhale deeply and take your both index fingers and close your ears with both the hands. Your hands parallel to the ground. And then exhale while making the humming bee sound. Hmm. Take your hands down and again breathe normally. Once, twice, thrice. Then again you have to repeat the same thing. I'll explain first and I'll do the instruction, the cues. That you have to inhale deeply, take your index finger and close your ears. And while exhaling, you have to make the humming bee sound. So get ready. Keep your back straight, close your eyes, relax your facial muscles, start observing your breath. Now, after next exhalation, inhale deeply. Your lungs are filled with air, diaphragm pushes the belly out. And now close your ears with the index finger. And while making the humming bee sound, exhale. If you just do the 5 rounds of this humming bee pranayam or Brahmari pranayam, it will again relax your nervous system very nicely. And the last thing which I would like to share with you as a de-addiction program in yoga, meditation, and spirituality is the power of mantra meditation. Mantra, manatrayate mantra, the thing which actually can liberate your mind, the thing which can purify our mind, subconscious mind, because mind has so many vrittis according to yoga. Vrittis means impressions, samskaras, and the thing which I talked in the scientific language called neural networks. In yoga, it is called vrittis, the impressions. So if we can remove them, if we can just wipe them out from our subconscious mind, then actually our urge will not be there. And also the uplifting of the consciousness happens and the orientation of the life changes. So there are so many mantras, but there are few mantras which are very special to begin with. And in yoga, we actually begin with the simple chanting of Om. If you can just sit and peacefully chant few times, you inhale and while exhaling, you chant the Omkara Uncharan. So that will be wonderful. And even while doing yogic breathing, you can do that. While inhaling, you inhale, and then while exhaling, you can do the Om chanting. So Om chanting is one of the most powerful sound vibration because it just purifies all the impurities which are there in our brain, in our mind. So this is my last recommendation along with yogic breathing, along with Brahmari pranayam, and also affirmations. And also you can do many other pranayams which are there, but breath work is like, which I taught you, like 2 main, which you can do anywhere, anytime, and just relax yourself. And reprogram your subconscious mind, remember, by doing the affirmations and contemplation of how smoking is beneficial or not beneficial. Thank you so much.
Thank you so much, Vivek Bansalji. That was tremendous, amazing. We always find, smokers, they're comfortable in that cozy corner. So, cigarette smoking, it gives me this kind of, it relieves stress. I feel good, I feel secure, I feel comfortable, mostly out of habit. So, definitely reprogramming sounds like a very, very effective way for people to give up smoking, give up tobacco, give up the ill effects of tobacco. Thank you so much, very informative. And Pavitra, we'd like to thank our doctors as well for taking time out and being with us on this day, for sharing knowledge with us. And thank you, Dr. Yuvraj Bhosle. Thank you, Dr. Vishnu Agarwal. Thank you so much for taking time out and coming here and addressing our audiences. We really appreciate it.
Thank you so much, sir, for giving us the opportunity to speak. Thank you very much.
Thank you so much. Thank you so much for the opportunity to Pavitra Connect, and you are doing great work. And we are really feeling proud that we are a part of you for this program. Thank you so much.
Thank you, Prabhu.
Thank you. Thank you for giving the opportunity. It's my pleasure.
Thank you, Panchal-ji. That's it from Pavitra. We hope you enjoyed our session. We hope it was informative. And we hope if you are a smoker, you quit. Have a Pavitra day.